All right, what's up, guys? Sorry, I already have my shirt off because I recorded the video, but for some reason the computer froze, it just went blank. So I recorded like the whole 10 minutes or whatever, and then it just went blank. But this is day 32, 33, something like that. It's like 1 a.m. October 28th, but it still kind of feels like October 27th. So it's like yeah, I think day 32, because again I had surgery on September 25th. So this is week 5. Sorry, I missed the video last week. I was supposed to, post one last week, an update, because I know I said one a week, but I did end up missing last week because of that wedding in New Jersey, which that was a whole ordeal, which was really shit for still recovering from surgery and everything. Basically, I was connecting from here to San Antonio and then San Antonio to Newark. The wedding was in New Jersey. Uh, but that 45-minute flight turned into this whole 3, 4 hour ordeal. Get on the plane, delays, and delays again. Then it's not a 2 hour delay anymore. It's an hour delay. Then we land. That's an hour delay. Long story short, miss the flight because of Spirit's stupid logistics or whatever these stupid delays. So I wasn't able to get on the flight till super early the next morning. So I did not sleep at all that night because I had to be at the airport 3:30 the next morning. And with the shoulder being in the plane, I was miserable. And my meds were in the checked bag, which was at the airport or on the plane. So if you're ever traveling right after the surgery, definitely try your best to have at least someone come with you so they can carry meds or carry anything you need, so you can sleep well, if you have troubles with that, because I definitely had trouble sleeping before the surgery with all the chronic tightness and everything, so afterwards it's definitely worse. But anyway, um, it is what it is. Let's just jump right into range of motion. So I'll just kind of, because I keep on doing this, but I'm not technically supposed to be doing holding it. So I can go about there. And then in terms of this range of motion, I don't know if you guys can compare to last video, but it seems like it's kind of getting there on this direction. And then I'll just use this as another kind of estimator of progress. So that's range of motion. If you want to look at the scar, here's the scar. If you do have brown skin like me, hyperpigmentation is really easy, which kind of sucks, but again, kind of poor camera quality, poor lighting, but you can kind of see it's still pretty dark here. It's all closed up for the most part. And again, this is about a month out. So, a little over 4 weeks. So there's one little spot that it's right here that hasn't kind of fully closed, but the PT told me, because I kind of asked, because everything's closed up. Obviously, it's still tight in the tissue. You'll feel probably pretty tough. I asked the PT. Seems like there's stitching that they do. The stitches sewing, but those are dissolvable, right? But sometimes they're underneath the skin and they're trying to come out. So that's why that little spot hasn't quite healed up yet. And then the staples on top. So I kind of got all these dots that developed around, which depending on your incision and I guess your skin color, um, that might be there, but it'll go away over time, is what I was told. And then, yeah, these are from my old surgery. They just kind of, I don't know, have a little constellation going on here. It looks like they just sawed off my arm or something. But anyway, scar update, range of motion update. Let's see. So not doing strength yet because still only about 5 weeks out. PT update. So it's pretty much the same. They did kind of introduce something new next week, which I'll go over. But just to go like beginning to end to give you an idea what I'm doing and what might be what you'll be doing. If you're still kind of in that deliberation phase of, am I going to do the surgery? If I do, what is it going to look like? So I kind of get in there. And again, this has been about the same since the very beginning, like week 1 when I started, which I went over a little bit in the previous videos, but I can just go over the entire thing right now to give you an idea. And then on subsequent videos, I'll just update changes. Sorry. I don't know. I'm like hiccups or something. So start off with the heating pad just to warm up the muscles, loosen things up, especially with me having all this tightness all around here. And you might be able to tell I kind of have some bruising here on the topic of tightness, which I'll get into later. Yeah, sorry. So sorry, it's like 1 a.m. and I'm like, I don't know why I keep on doing these videos this time. Keep on procrastinating, but the heat, and then since I have the wrist issues I've had for a long time, because this has all gotten weak probably. I start off with some putty because this, I just put pressure on it. It hurts, do this. So it's hopefully strengthening that. Putty 3 to 5 minutes. Then do the scapular retractions for like, I don't know, 3-5 minutes maybe as well. And then shoulder shrugs. And then done with that, take the heating towel off thing, go down to where they have the benches, and then they put on the glass thing, put a towel, and then do the towel slides. So just, to increase that range of motion. So you'll kind of push into where you can go, and there should be slight discomfort, right? Obviously not trying to stress the tissue too much, but just enough where there's slight discomfort, but not too much pain. And slowly you'll do that until you can, like, because before I could just do this. Now I can pretty much get to the end of like the glass thing. And I don't have that 90-degree restriction anymore on those. After that, so these are the kind of newer things. So there's like the big exercise ball that I'm just like standing up, and then it's on the table, and you use your left hand or whatever hand that wasn't operated on. That does all the work, and just kind of go clockwise, counterclockwise. So again, working on getting that range of motion back. And then this is table slides again, but the difference is I'm kind of going on an incline now. So before it's just on the table. So this is the difference. So it's kind of at an angle here, and then my hand's here, and I'm like, pushing up on an incline. So those are 2 newer things. And then the third thing that I did that isn't necessarily physical therapy in a sense of exercises, but something called dry needling. So you can kind of see I have some bruising here, and that's actually from needles. So my PT kind of brought this up, recommended, or not, they just kind of asked, if I wanted to do it. And basically, if you are in my situation where you've had chronic tightness for a long time, so despite all the massage or stretching or, shove a ball in there or whatever the kind of method to beat up all that tissue and loosen it all up, and it doesn't really work because it's just temporary relief. Well, this is obviously not going to resolve it permanently, but it's kind of a stronger method. It's called dry needling. So he basically put in needles, and the first time was actually on the back. I was like face down on the table, doing it like in my kind of scapular muscles, partially on the trap, and he basically put needles in, and then attach little electrodes to it, and then send electrical impulses through the needles. So I asked, what's the purpose of this? Obviously, like I try to get really deep understanding as much as I can, because I kind of have to with how many issues I got going on. But the idea is And again, you can ask your PT if this is something they offer. Um, with all the chronic tightness, right? Like I said, you can do all those things, but what can happen with all the chronic tightness is that those muscles are so constricted that there's no circulation going through them. There's no blood flow, right? So no matter what you do, it will just quickly go back to how tight they were. So the idea is this dry needling, these electrical impulses, the stimulation will get to the muscle. Of course, that's going to contract it, and they'll like jump. Like, let me see. I have a video of it. So this is kind of gross. So if you don't like needles, don't look. Oh God, you cannot see anything, can you? Damn. I wish this wasn't so much of a glare. I don't know if you can kind of see that. So that's in my neck. It's just jumping. So it's gonna, send electrical impulses, obviously contract that muscle, and the idea is it will help with the tightness and loosen things up, and get blood flow in there, improve circulation. So if that's something you want to try, definitely ask. Um, wouldn't recommend if you really don't like needles, right? Not saying I love needles or anything, but it's something that I've kind of gotten used to growing up, and I'll do anything as long as it works. Um, but yeah, those are some of the new things. It's the PT update. Um, yeah, this is week 5. Um, just kind of forthcoming stuff. I mean, I got the my next follow up, which would be the 6 week follow up on November 7th. Um, next week is Halloween. Actually, no, that's in like a few days. Yeah, it's the 28th. So I did get I kind of was like, let me just be like some zombie patient. I was trying to use the sling in the costume, right? So this is technically, it's a zombie doctor. I just found it on Amazon. But if you're curious, just because I mentioned that last time, so I'm just gonna like, I don't know, just be like this, right, in the sling if I go out, because I'm still supposed to wear it when I leave the house. So that's the Halloween update, I guess. And then yeah, my bad for missing last week. I'll try to make sure don't miss next week. But yeah, this is week 5. Um, progress slowly but surely. I hope you guys have a good one. Hope you guys have a good Halloween, and we'll see you next week.